So first, I want to thank you, Brooke Reynolds, who is now a board certified veterinary dentist. You get extra letters behind your name.
Yep.
I want to ask you a little bit about how you got into veterinary medicine initially and where you grew up.
So I grew up in a small town in central Pennsylvania. Always had that deep love of animals, as most of us do. And I told everybody since the age of 5 I was going to be a veterinarian, and I never changed my
Same.
mind.
Yeah, me too. Isn't that crazy?
I've had many people try to deter me and say, "Oh, what if you don't get into vet school?" And I was like, "Oh, I will." So everything worked out. So followed that path straight through. Started volunteering with veterinary clinics when I was about 14, 15 years old, shadowing just to get more experience and everything like that.
So, did you start out in the kennel? That's where I started out. I worked for a relative of mine, my uncle, but he owned a practice in Cary, and I think he was kind of forced into hiring me by his parents. I don't think he had a position that he needed me, but the little hometown I was in, they're like, yeah, he's a veterinarian. He owns his practice. We'll make sure he gets you a spot. So I called him. I think he was forced to because I was like chopping weeds and all sorts of stuff. Yeah, I started in the kennel. But you learned a lot there that you didn't realize you were learning. It was kind of like the Mr. Miyagi thing. It's like, oh, now you know your breeds. Now you know when that dog's probably looking at you in a funny way, and you might want to be careful. Like
Yeah.
things you pick up that you just don't realize. So did you start in the kennel or just shadowing, or what did you do?
Shadowing for the most part for about the first year or so, and then they let me do a little bit of assistant duty. Like I was allowed to draw up vaccines, grab
Yeah.
paperwork, help with that. And then when I was a senior in high school, I got hired as a receptionist at an ER clinic. So that was really neat, kind of learning how to triage patients and all of that.
That's not an easy role.
No,
I mean, that's hard,
a lot of
and
respect for
sometimes more
receptionists.
sometimes more difficult than what we have to do now is trying to figure out do you really need to be seen right now and all the triage stuff.
Yeah.
So that was in a different state. How did you get to North Carolina?
So I went to Virginia Tech for vet school and then had a classmate that lived in North Carolina. So after I graduated, worked at a practice in New York for a year. Didn't really like the weather up there. Not a great environment for my husband. It was pretty rural, so he had trouble getting a good job. So we looked around. My classmate said, "Why don't you come down to North Carolina?" So I did. Came down, interviewed at a couple practices, and I think one of them was yours. And that's how I ended up in North Carolina.
Yeah, we actually got to know you before you were had all these other things that you're doing. I could tell very early on that you had a lot of skill set in. I would have guessed that if you would have specialized that you would have gone into surgery because from the start you had a really good ability with your hands. Like you had a lot of when initially I think myself and Dr. Amat, he's big time in the surgery. He's like she's got some really good skills like a piano player or something. You could use your fingers really well. So I was a little surprised that you got into dentistry. So how did that happen?
Actually, I always loved dentistry. I loved it in school. And the great thing is about dentistry, it's still surgery. It's just in the mouth. So you do surgery pretty much every day. We have medical cases too. But if anything, you have to be a little bit more careful in the mouth. You got a lot more important structures very close by, eyeballs and things like that, important nerves, blood vessels. Um, and my clinic in New York I worked at had a lot of dentistry, so I got into it there because the owner I worked with, he said, "Hey, I don't really like dentistry, do you?" And I said, "Well, yeah, I kind of like it." And he's like, "Good, you're going to do all the dentals." So that kind of started it. And then I certainly did some dental work with you guys. And then after I left Poplar, I worked at a clinic and started doing additional CE courses in dentistry to expand my knowledge. And it just went from there. And then ran out of CE courses. So went into a residency from there.
And that is really impressive to me because you did your residency after you were already established, you were already a veterinarian, you had started the family, and you also had a novel, and now you've got another one. So you write novels in addition.
Yep.
Like how many things can you pack in, Dr. Brooke?
Yeah, I always like to stay busy. I usually need to be doing 4 or 5 things at a time, so that keeps me going, keeps me happy. So,
And I did audiobook your first novel, and it was really good. I liked it. It
wow.
was
I would definitely
it had
recommend.
a bit of the medicine in there, which was really good.
I think you'd definitely like the next one. It's all short stories, but much more medicine focused, lots of veterinary related stories, and I believe you show up in one of them very briefly at the very end.
Oh,
Just a name
okay.
drop, but
Okay. So I will take it. That's the most famous I will be.
there you go.
So one thing I did want to mention before we get off is we are I hate to say this, it makes me feel really old to say that myself and Dr. Ahmad we're the old guard at Poplar now, and we do have more interest in dental. Dr. Stroud is doing a lot of good dental stuff for us. We brought in dental x-ray, which we're now convinced you have to have because we have seen the things that we were not seeing before. And one of the things that we're trying to move forward on is getting folks like myself, but get our veterinary group to recommend dental cleanings when they are really more appropriate rather than, I hate to admit it, but my likelihood was to really kind of wait until there was enough tartar that I was seeing it and it was causing some redness before I felt like it's worth it to those folks to have the dental cleaning. And in reality, we know in all of the human side of things, you don't do that. This is a preventative procedure in the best of cases, and your teeth, and you can tell us all the gingival care and the periodontal ligaments and everything are much better if we get a cleaning earlier in the course and we get those initial radiographs, the x-rays of the entire mouth to see some of those things that we wouldn't find otherwise, like a tooth we didn't think was there that's just unerupted, and we've seen lots of things. So I am a convert and believer, but I think our owners and veterinarians, myself, were one of those that were like, well, if it's going to include anesthesia and things like that 20 years ago, that was even a little different. Nowadays, our ability to do these things in a safe type of situation is a lot better. So, what is your advice to our veterinarians, our owners, our staff, as far as when is it the best time to get that first cleaning and evaluation and the radiographs done? If we could make this a really nice, affordable like package for preventative care.
Yeah, I mean, it all kind of depends as far as breeds, patient selection, of course. But if you're looking at the statistics, 80% of dogs develop periodontal disease by the age of 2. So that's a good marker there for the most part. And that's 70% of cats too by the age of 2. Now, that's going to be much higher percentage of actual bone loss, periodontal disease found in your toy breed or your smaller breed dogs. But you also have large breeds that are going to be more prone to that. Poodles, greyhounds are kind of stereotypical for getting early periodontal disease. And then for the big dogs, if you're trying to look at how to convince owners, well, maybe I have a big lab or a big sporting breed and they don't really have that much buildup, right? But I think the difficult thing is plaque, which actually causes the periodontal disease, not the tartar, it's difficult to see. It's kind of a film on the tooth. It doesn't have the discoloration. The coloration you see is tartar, which is hardened plaque, and all that does is give surface area to the tooth for the plaque to stick to. But otherwise, plaque is going to stick to the tooth regardless and builds up within 24 hours of a professional cleaning. So normally that'll sit on the mouth and not do anything. But eventually things happen, stress for the patient, maybe they get sick, and the oral flora or bacteria count changes in the mouth. And all of a sudden that causes an inflammatory response. So I think a lot of owners can appreciate that inflammation is bad. So what does that do? The body attacks the system. You get gingivitis. Gingivitis is 100% reversible condition. So owners like that because even if you see some redness, some bleeding when they're chewing on a toy, say, hey, we can get them in for a cleaning, get that cleaned up and prevent bone loss. Once it progresses, you're going to get bone loss where the body will eventually eat away the bone, and you can't put that back. And some owners will give you pushback too and say, well, if the tooth is just going to fall out, maybe it's not an issue, but it's painful for your pets. And I think that's an easy way to convey that to the owners because they care about their animals and they don't want to see their pet in pain. If you've ever had an owner that had dental pain themselves, they're going to be much more likely to do stuff than somebody who hasn't experienced that. And then as the dental world evolves, we really mirror our technology and research with human medicine. So different things that are just common in human medicine, bone graft, things like that, we can do in our veterinary patients. So certainly preserving teeth is helpful. And even when you get those patients that are 2-3 years of age and already had periodontal disease, the way you get them to come back is you can cause a stasis or prevent that disease from progressing further. So maybe you have some bone loss, but you can maintain that height of bone for a long period of time if the owner is willing to do home care or come back for a regular cleaning every 6 months to a year, depending on the patient.
Right. I mean, it makes a lot of sense, and we can see a lot more now that we're taking the radiographs and we can see where the bone loss is starting. But ideally, you would catch that before we get to those points. And I think one of the bigger hurdles in the veterinary side of things is the fear of anesthetic and also the fact that our patients will kind of eat through the pain in a lot of cases.
Right.
So owners imagine themselves, as a human, man, if you got pain, you start feeling it and you call the dentist, but it hurts and like you don't even want to eat on that side, you'll move it over. And sometimes I think they will think, well, if my dog is still eating, it's not hurting, which is not true. I've seen dogs eat through things that we know they have pain.
Yeah. And I think that's a hard thing to talk about. But if you kind of relate it to the fact that natural instincts of animals are to hide pain, that can be, an appreciative thing. And then I think some owners are more in tune or can recognize pain in different ways. Yes, your pet may still be eating, but maybe they're not playing with their favorite toy as much as they used to. Or maybe they go to pick up a toy and suddenly will drop it. Other things you can see is some cold sensitivity. Maybe a dog used to love to eat ice cubes and suddenly won't. Maybe they don't want to eat hard food anymore and have switched to dry food. It's different things like that, or you get a small toy breed dog that suddenly doesn't want their face touched or brushed or groomed or anything like that. You can see that with dental pain.
Yeah,
Um,
grooming can be big with that. That can be a little. So the signs can be there. They're just not as easy to see. You have to look for them a bit more.
Yeah, and I think the big thing is a lot of times with our cases, it's when they come back in for the recheck after you've addressed the pain and said, oh, my dog is acting so much younger, they feel better, they're more energetic. Well, yeah, because we've relieved pain. And I think another
We
thing,
see that a lot with the mouth, with a glaucomatous eye. When I finally get them to let us remove it, and with
Mm-hmm.
ear pain.
Yeah.
It's like once it's gone, wow, he feels so much better. But it was hard to detect it because it's not something like a knee joint where they just lift it up and limp. You know.
Yeah. Cats are another patient that's going to be very stoic. It's very rare that we ever see cats not eating related to dental disease, though a lot of times they like to blame it on that. But cats will show more signs of subtle pain, especially with tooth resorption, which is a radiographic diagnosis. So that's a good thing to get cats in early. Typically tooth resorption can present as early as a year of age. That's you find on radiographs. But cats with tooth resorptive lesions, if you touch their teeth with a probe, even when they're fully under anesthesia, they can still chatter. Um, Owners suggest that
Yep, I've
they've
seen that.
seen where cats will switch and only chew on one side of the mouth. They can paw at the face. They can even scream out in pain with severe pain. So at least from a cat standpoint, their dental disease with tooth resorption and stomatitis definitely has more visible signs of pain associated with it.
And many times there's a significant odor with those cats too.
Correct. Yeah, and that's a big thing that the owners will notice. And you can certainly see it with dogs too, when dogs get more of the ulcerative lesions and things like that. But even dogs with severe periodontal disease, some of them have odor and some of them don't. Some owners almost seem nose blind to the odor as well.
I've seen greyhounds have an odor that is just can sometimes be you can tell when they walk in the room.
Yeah, yeah.
So the one thing I think we do better now than we used to, in addition, is to help our anesthetic with local blocks so that we don't have to have this super deep level of anesthesia and we can still control for pain, and that increases our anesthetic options. So the concern of having anesthesia, it's always going to be there. It's never going to be zero. But the newer anesthetics and things that we have and the way that we can control pain without being at those deep levels gives us a lot more options to reduce some of that anesthetic risk and maybe make owners a little bit less likely to completely say no to a healthy patient getting that dental cleaning when they really need it before that gingivitis turns to periodontal problems.
Yeah, I think that's definitely true. Anesthesia has come a long way, and at least from my training, a good portion of training with the dental residency is increased training in anesthesia because every one of our patients has to go under anesthesia. So we have to be well versed in that. So definitely nerve blocks have come quite a long way. We've done studies about different ways to extend the nerve blocks to make them last longer. Of course, we have bupivacaine now, which is kind of at least gives you 4 to 6 hours of pain control. And it has pretty relative quick onset of about 5 minutes. So most of our patients, right when they're being sedated and intubated, they're getting their nerve blocks immediately while before they even get radiographs performed and things like that. So by the time we're doing surgery, they're already on board and you can keep them at a lower level of the anesthetic gas. I think our protocols too have changed quite a bit. Safer drugs being developed, alfaxalone, is a big one
Mm-hmm.
that we
Yep.
certainly utilize a lot. And then just more information and knowledge with CRIs and different things like that to control pain, to keep them on a lower level of gas, anesthesia. Our clinic specifically uses sevoflurane, which isn't always attainable in general practice due to cost, but that's always another option too. And I think the world is certainly in veterinary medicine evolving, providing owners with different options. We even started utilizing, in addition to our in person anesthesiologist, we have a remote anesthesiology service available as well for certain clients, where an anesthesiologist will come in via a Zoom link monitor our patients with us and then kind of help gear our technicians about different parameters and things like that to look out for. So,
I imagine is that more for the cases that are more advanced or have some cardio risk or something in addition?
yeah, certainly we can offer it for pretty much any patient, but we utilize it more for those that have increased risk. And then those that have multiple comorbidities, we'll bring the actual anesthesiologist in for. Um, Owners, I think pet owners are more likely to follow up with recommendations now than they used to be. So when you first diagnose that murmur, a lot of them are certainly going to follow our recommendations and go see a cardiologist. So we work hand in hand with the cardiologist too for our protocols. Certainly, they are a good resource as well about trying to make sure the anesthesia stays safe for these patients.
And mostly what we're looking at starting now is to look for our very healthy patients and still be able to reduce that need for the deep anesthesia, having things a little lighter by using blocks when needed, and really starting our patients when they're even pre-gingivitis to get that initial cleaning, get a package where it includes the radiograph so we can make sure there's nothing hidden there that we can't obviously see, visibly because it's below the gum line.
Yeah, you can certainly have, unerupted teeth, very, very common in our brachycephalic breeds. Your most common breed right now is the French Bulldog. Um, they're an anesthetic nightmare to begin with, but, they like to have unerupted teeth. So certainly looking for that ahead of time. And then certainly there's all kinds of developmental disorders that can happen with the teeth that can be found on x-ray. And even young dogs without gingivitis can fracture teeth. Even if it's not into the pulp chamber, it still has a 25% chance of dying and causing an abscess, which you find with radiographs.
Perfect. Well, you've given us a lot of good stuff. Last thing, what's the name of your new book so people can find it?
The new book is called A Night at the Shockplex. It's based off of the first short story has the same name, and it includes about 18 different short stories that I've written. Most of them were previously published, but this is a nice little collection that
Like a compilation then.
yeah, that was released prior to Halloween, so get everybody in the mood for the spooky season. But obviously, I wrote most of them when I was in general practice, so lots of animal involvement there and some fun stories for sure.
Great, and we can find that on Amazon, I imagine.
Amazon, and then there's a Audible as well has the audiobook. So,
Cool. So we'll check that out. And is there anything new on your plate as if you don't have enough? And tell us about your little ones.
well, I have three kids now, so they are 3, 5, and 7. So the older two are in elementary school, second grade, and then kindergarten this year. And then the youngest one is trying to keep up with her as she runs around the house, so that's fun. And then other than
One of
that,
them I just saw on your
enjoying.
Facebook looks just like you.
Yeah, she very much is. She's my mini me. So
Yeah.
balancing all of them and trying to enjoy being boarded dentist and hopefully looking to get into writing some more papers and giving back to the college. Joined a couple committees and things like that to help further the dental college, and then we'll be doing some CEs and different things like that to try to help out the local veterinarians as well.
I saw one of your CEs that was coming up that was really good. Or you may have already completed it.
Yeah, I think that's actually tomorrow. We're starting a webinar series, Ask the Expert. We're trying to still plan what time of day is best for veterinarians, but we thought like a little roundtable discussion would be good that they can jump on, send radiographs ahead of time or questions. We can talk about cases. I've also been going around to a couple of the clinics and offering roundtable discussions where all the veterinarians have me for about an hour to ask any questions on equipment, Even their anesthesia, did that at one of the clinics, or just general questions on dentistry or how to deal with and manage certain cases.